On this episode of Newt's World, I've been doing a series of podcasts on Ibogaine as a potentially effective therapy for treating post-traumatic stress disorder, opioid addiction, and depression. Ibogaine is a level 1 substance as classified by the Drug Enforcement Agency in the United States, so many of the treatment facilities are located in other countries, including Mexico and Canada. After my conversations with both W. Brian Hubbard from Americans for Ibogaine and Dr. Nolan Williams, who conducted a Stanford study on Ibogaine, I was contacted by Ambio Life Sciences, a company based in Mexico that administers Ibogaine treatments. They have a great deal of experience in treating patients who come to their facility for Ibogaine therapy. So I wanted to have them on to talk about the process of what patients experience. I'm really pleased to welcome my guests, Jonathan Dickinson, CEO, and José Inzunza, Chief Medical Officer. They are both co-founders of Ambio Life Sciences, a global leader in integrative Ibogaine treatment. Jonathan and Jose, welcome, and thank you for joining me on Newt's World.
Thank you very much, sir. It's an honor to be here.
Thank you so much for the time.
Jonathan, you've been working with Iboga and Ibogaine since 2009, both clinically and ceremonially. What originally drew you to this work, and how has your understanding of its potential evolved over time?
Yeah, so I began working with Ibogaine in late 2009 and had to come down here to Mexico to begin doing that work. What drew me originally was that when I was in high school, I was having a challenging time at one point, and I went into my general physician who had me fill out a 9-item questionnaire that had Zoloft written on the top corner of the header, and it determined that I was depressed and needed a Zoloft prescription. So for several years, I tried that and other SSRI antidepressants and realized that they weren't really helping me much and had a very, very difficult time coming off of them. And so I actually found other psychedelics early in my life, several years after that, and after going through difficult withdrawals, and they really helped me turn a corner and sort of feel like I was real again and I could connect with life and to feel motivation and passion for the world. And so that put me on a research track that landed me in Mexico. And so originally, when I came down, most of the treatment centers were focused on opioid detoxification because Ibogaine is unique in its ability to be able to mitigate withdrawal from opiates. And so that wasn't necessarily my own experience, but it was such a powerful and compelling use case for a psychedelic that I dove right in. And it wasn't until 4 years ago when we started working with an increasing number of veterans who are looking for Ibogaine treatments that we started to see the kind of story about what Ibogaine was and its potential and what it could do start to expand into other arenas that were more similar to my own background. So we have had the opportunity now, working with veterans, to be able to see what it's like for patients who, I guess before we might have looked at a lot of the health improvements that people had and attributed to the fact that they were no longer using drugs. And now when drugs aren't always a factor, we're seeing all kinds of sort of generalized health improvements or neurological improvements that maybe are even underlying some of the benefits for people with addictions. And so at Ambio, in addition to working with Stanford and Dr. Williams, who you had on previously, and looking at its benefits for traumatic brain injury in veterans, we've also been able to see and start to describe some of the treatment effects for people with other neurodegenerative conditions like Parkinson's and multiple sclerosis, neuropathic pain, and other kinds of treatments for which there are no existing pharmacological treatments available.
You're entering this new zone, and Jose, you've been a paramedic and a firefighter. What brought you into the whole Ibogaine treatment world?
Okay, yeah. So in 2009, I was working here in Tijuana in the fire department. So here in the border, we are dealing with opioid epidemic since the 2000s, right? So I was pretty close with dealing with overdoses and treating these type of people in the streets. So around November of 2009, I was invited by one of my teachers to go and sit in front of a patient going through an Ibogaine treatment. I didn't know back in that time what it was Ibogaine, but I did my research and I find out a lot of really interesting stuff. Primarily, the power to reduce the withdrawal symptoms in a matter of 24 hours with this type of patients. So since day one, I was able to experience and sit with somebody going through this process. I was amazed by the power of this substance. I was able to see somebody going through a really hardcore addiction of a lot of years, then going through Ibogaine in a matter of 12 hours, 24 hours, this person reduced dramatically the withdrawal symptoms that she was feeling. So at that moment, I kind of realized that it was really interesting and a really powerful medicine that I didn't get teach in school that exists. So for me, it opened a window to see the possibilities of healing and therapeutic support with this medicine in terms of trauma and addiction also.
This was kind of a fortuitous piece of luck. That you observed it, you saw it, and you began to respond to it. That's kind of amazing, isn't it?
It is.
Now, the two of you have both been working with this. In general, what would you say has the reaction of the patients been so far?
So generally, I think what we could say is that people feel a sense of choice and agency return where some aspect of that had eroded in their lives. And so it's maybe my attempt to try to find a common denominator amongst people who have been using drugs and feel like they don't have the option to stop. Like when we get into an addictive pattern, it often feels like by the time that we think about acting out on an impulse, we're already well into the process of doing it, right? And so Ibogaine, in a very short amount of time, puts that back within a realm of choice where we can have thoughts about a certain behavior and choose not to act on it. I would also say that one of the big motivations, I think, for veterans coming down, and one of the big goals of the organizations like Vets Incorporated who have been providing grants for treatments, is for folks who are dealing with such intense psychiatric or neurological symptoms that they're contemplating suicide. And so I think one of the challenges when people are facing that kind of impulse is not necessarily that there's a desire to die, but that they kind of feel backed into a corner and like choice has, again, in a different way eroded from their life, and that maybe suicide is kind of this point of finality, like being able to take back control of the story and have some sort of control over life again. And so I think, again, when people are able to go through treatments, and whether it's the psychological process that unfolds or the neurological improvement that we're seeing, or some mixture of both, I think, again, people feel this sense of choice again and this agency to be able to engage in life in novel ways. And so I think it's difficult because we're getting to see people from such different sort of walks of life and different backgrounds. But I would say that's maybe one of the commonalities, is this increase of kind of agency for life.
So people come and experience, and I like to say, in their three bodies, right? In their mind, the psyche, but also in the body. And it tends to heal also what we call a spirit, right? That's what the sense of the experience they have when they come through. Seems like all the options to keep going in life has end for them, and they don't see any exit to see the light or the beauty in life. And they come with all these negative emotions or this sensation where life is just going uphill and they're getting fatigued to keep going and to keep pushing. So we see that this synergy between working in the three bodies, to say like that, it creates a huge impact with what Jonathan is saying, which is just a matter of having choice in their life. Just a way to see that they have options. And it's not just the way they're acting in their life, but also see a different perspective and see the light out of it. It seems like the cloud that they have over their heads, it goes away after the journey. And they go through some physiological aspects, as in the acute phase of the treatment and then after. So it's a process. It's important to say this. It's not just a magic pill, a magic bullet that you just take once and everything ends or you're going to cure everything. It doesn't work like that. It's more profound. And it's important to mention also that this is not a cure for addiction, right? This is a huge tool for dependency, to help people for dependency and for the physical dependency, right? After that, there is still some work that we need to do in matter of changing habits and take advantage of what we call the critical period and the neuroplasticity that happens after the treatment.
We're right at the absolute cutting edge of science, and that Iboga contains at least 13 different alkaloids. As the two of you have worked with it, what is your instinct about what is it that makes this such a uniquely powerful intervention?
Well, I think we still have a lot to learn about how Ibogaine works. What we've seen when we're working with other alkaloids, which are pretty minor sort of constituents in the plant material, is that the mixture is quite a lot stronger than just Ibogaine on its own. So we don't really know necessarily if that is because some of the other alkaloids are much more potent by weight than Ibogaine is, or if because they have some kind of synergistic effects or they change how we metabolize the Ibogaine itself. Overall, whether we're working with the Iboga extract or working with purified Ibogaine, there's a very consistent type of clinical effect that we get from it. There's not a huge improvement from using very pure material. In fact, what we find when the more pure the Ibogaine is, the almost more that we have to use, because again, it's less strong when there's less constituents in it. So clinically, or at least in the manufacturing process, at least when we're not trying to satisfy FDA regulators, there's not a huge return on investment for the increased cost of reaching that level of purity. And we can work with sort of a botanical drug to achieve the same or sometimes even like more interesting subjective effects.
I'm reminded of the old story that you could never get aspirin approved today because we actually don't know how it works. We've grandfathered it in and we can produce aspirin and billions of people have taken it, but we literally could never meet the FDA standard. To what degree does the very complexity of Ibogaine, when measured against what clearly is its impact, put in a kind of similar situation where we could spend so many years trying to figure out what the underlying mechanisms are, and we're losing people every year while we're engaged in that kind of academic research?
Yeah, I think it's a really good question that kind of goes to the regulatory process. I think with aspirin, one of the reasons why you might have an issue getting it approved is because there's other things on the market that have a similar kind of treatment effect. So unless aspirin is substantially better than anything else that's out there, without understanding the mechanisms, it might be hard to approve. In the case of Ibogaine, it's very true. We don't understand fully its mechanisms or how it works. We have a lot of signals to work with. Ultimately, I think that the process of studying Ibogaine is going to help us to better understand neuroscience and pharmacology. It's going to drive us towards new disease targets and make us think in a more complex way about how drugs interact with neurons and other cells in the body. But the benefit that Ibogaine has, even though we don't necessarily have a fully transparent picture of how it works, is that its treatment effect is unmatched by anything else that we know of today. So I think if you're able to show that in a clinical trial and it's evaluated on those merits, then it stands a chance.
In a sense, we can show you evidence that works, we just can't show you an explanation.
Yeah, I think it depends to what degree can we be certain about how it's achieving the effect. And right now, I think we're still a ways from being able to claim a high degree of certainty about that.
As Ambio's co-founder, Jonathan, you led the development of clinical guidelines for Ibogaine-assisted detoxification, which remains a standard in the field. In your experience directly between the two of you, to what extent have you been able to minimize the risk of side effects while helping people go through Ibogaine?
Yeah, I think this is a really interesting question, and it sort of benefits from having a little bit of background about the history. So when Ibogaine was first tabled in front of the FDA, it was the early 1990s. And this was the effort of Howard Lotsof, who discovered that as a young heroin user living in Staten Island, New York, when he took Ibogaine without knowing what it was for, just experimenting with different compounds, he found that he had no more withdrawal, no more cravings or desire to use heroin again. And years later, he kind of took up the mantle and pressed until he got to the point where the FDA was allowing clinical trials, and the National Institute on Drug Abuse were funding some of those studies. Unfortunately, for various reasons, the studies were discontinued. And after that time, there had been so many people who had been through Ibogaine treatment and seen the effects. Cat was out of the bag, so to speak. And some of the people who'd begun working with it ended up either working underground in the United States for a period of time because it was a Schedule I substance, or left the country and ended up in Mexico. And Mexico has been sort of a fertile ground for the development of the clinical protocols over time. And so when I came down in 2009, there had been a number of fatalities and other kinds of adverse events that had occurred. And so I led a process of consultation with providers all over the world, largely in Mexico, where most of the treatments were taking place. And we worked with those clinical providers with their experience, as well as medical professionals and researchers, to identify what the primary risks were and very practical measures that could be taken to reduce them. So at this point, and Jose can speak to this more about how we've developed that practically, but I think we have a very clear idea about how to screen for and prevent cardiac risk with Ibogaine, which is one of the main issues that normally gets brought up. I think that there are still risk factors that are in play, especially when we're looking at trying to take people off of street drugs, and there's unknown quantities because drug interactions are another of the primary risks. So clinically, we do everything we can to control against the risk of people using drugs that we don't know about, or that perhaps that they don't even know about are present in substances that they're using. But if we're treating people who are not coming off of drugs and we're just trying to reduce the risk of cardiac conditions or other kind of pre-existing medical conditions causing harm, I think we have a very good, strong understanding of how to mitigate those risks. And we've demonstrated that clinically over years, treating thousands of individuals.
Well, Jose, let me ask you about that. As people go through this process, in the early days, as I understand it, there was a real concern about cardiac problems and that it could lead actually to heart attacks. To what degree have you all been able to develop an approach? And as I understand it, part of it may involve combining magnesium with Ibogaine. But to what degree now is the risk of a heart attack a dramatically lower risk than it was when people first began experimenting?
Yeah, so basically a lot of the work that we have done to mitigate the risk with Ibogaine and the cardiac situation, it was just to use magnesium. But that's just one key of the whole protocol, right? Something that we have worked a lot is on the preparation of the patient, and it's to assess a proper preparation. So we need to understand that basically Ibogaine is like going into surgery, right? And the more stable your physical body is into going to surgery, less of the risk it is for you to go into bad situation. So this is a controlled treatment that even that is treat of life or death, we need to prepare the person physically for them to go strongly into the treatment. So some of all of the keys that we have done to prevent or to mitigate cardiac risk is to evaluate really deeply the heart of the patients. Also understand that sometimes medications are contraindicated with Ibogaine and we need to stop those medications. And we're talking here about SSRIs, antidepressants, antipsychotics. So these are medications that normally are really contraindicated with Ibogaine. So it's not just the magnesium part, it's also like hydration, is also helping the body with the metabolism after the Ibogaine. Some of the things that makes Ibogaine really complex and the mechanisms of action is like the effects on the body can be lasting 24 hours, 36 hours, but the benefits of that, it comes after those 24 hours of 36 hours. So it means like once after the metabolite is out of your body is when you start feeling like the positive effects, right? And that makes it really unique. That's something that we are not used to in medicine, right? Where we normally are getting this instant gratification, right? Like I take the Advil and it's going to kick in 20 minutes and an hour, and then it's going to take away my headache, right? So done. But then with Ibogaine, it's like longer, right? It's going to stay in your body for 24 hours, 36 hours. But then after that is when the positive effects are going to be coming. Is when the neuroplasticity with all the effects on the cellular level or the ATP level is going to be happening as a reward. So the specs going back into the cardiac itself is not just the magnesium or the proper electrolytes. That's how we call it. Because Ibogaine, it does block the heart channels, but it's mostly how to prepare the patient emotionally and physically to go into a treatment, right? And physically, we're talking about reduce all the medications that are, for example, prolonging the QT segment, also making sure that the people is well hydrated, has a proper diet, has a proper digestion, a proper metabolism, and then we get to a point where we can serve the medicine and mitigate those risks, right? So it's a big screening, and I used to say that it's basically like if somebody was going to surgery.
In a number of studies, you have an initial impact, but then there's a significant number of people who ultimately relapse back into some kind of addiction. Does that indicate that for a lot of people, this is great to break the pattern, but then you have to have really substantial help in order to acquire the habits to not relapse back into the habit? I mean, how would you read that?
Yeah, I think there's a lot of things that are factors when we're talking about addiction. And so one of them is that there's a pharmacological element. Drugs take hold of the brain and the nervous system. And that's just one of the factors people experience withdrawal and craving, which get worse, actually. The more that people use, the more that people try to come off of them. There's an effect where those same withdrawal symptoms kind of get worse the more that we go through that cycle. And so Ibogaine can help dramatically, better than anything else, with those kind of physiological aspects of addiction. But there's also psychological aspects. There's also social factors that contribute to addiction. And so it's something that we try to prepare people for when they're going into treatment, that the more that they can prepare to take Ibogaine, considering it sort of like assistance to ease a big life transition, the better that they can do on the other end, right? So the more that they have things set up when they get home in a supportive setting, the better they're going to do. I don't think we could see a huge benefit taking people off of the streets and then putting them back onto the streets, for example, just as a sort of extreme image of that. But if people are attempting to transition into supportive housing and other kinds of work programs, and then need to undergo chemical detoxification as part of that process, Ibogaine can be part of the picture, I think.
Do you think that ultimately there'll be some kind of sophisticated connectivity where you go in, you detox, but then you're almost expected to go through a rebuilding of the right healthy habits, that the two have to be combined for it to have optimal impact?
Yeah, that is correct. That's basically how this gets present, this treatment, right? Like I said before, it's not a magic bullet. It's not something that is just going to change your life in a matter of a day. It's basically that. So Ibogaine is a great tool to mitigate the physical withdrawal up to 90%. And then also is really beneficial opening, again, the critical period with this process when you can create neuroplasticity, which that means create your perception of life and create new habits, right? So this critical period is really important for the people to understand that's the moment where they want to change really the activity of their lives so they can just create a new pattern, right? And that's as big as important as the Ibogaine treatment itself. So that's where Jonathan is mentioning to prepare the patients and the people, right? To not just expect an easy cure and an easy step. It's going to be really helpful to mitigate the physical withdrawal, which is like the biggest part. But then alongside to that, you're going to have to create your new life and work towards that.
To build on that a little bit, I think it's really important that people feel very motivated to make that change for themselves. Again, like I said, I think one of the common denominators is that Ibogaine gives us back a greater sense of agency. And so when people are already pursuing a change for themselves, they can make great use of that increased agency and ability, right? And so I think one of the things that we see in Mexico is that by the time that people come down here, they've already tried a lot of other things in most cases. They actually have to overcome quite a few hurdles to get down here. So by the time that people are coming to us, they've expressed and had to act upon like a great deal of personal motivation. And we think that contributes a lot to the success. So I think it's important that when we look at Ibogaine, we see it as part of a process and learn how to maximize this kind of efficacy in that way.
One of the things that led me to want to interview you two is that when we did a podcast with Dr. Williams at Stanford, you all somehow connected. And so now you have the imprimatur of Stanford University, which is one of the great research centers of the world. And then they are remarkably positive about what you're doing. How did that come about? I mean, I think that's very interesting that Ambio ends up working with Stanford on a really national class study.
Yeah, I mean, that came out of the relationship that we have with veteran community, with organizations that are supporting veterans to take Ibogaine. They were really the common link between us there. But yeah, it was an incredible experience to be able to have. I think we've had a really good relationship with different research partners over the years. Obviously, Stanford is one of the more prominent ones because the study's already been published. But I think with the real world evidence and clinical experience that we have, we've been able to even go back to other research partners as well and help to drive some of the cellular research and animal research, because we're able to sort of hone in a little bit with them on what would be interesting to look for. So I think it's been a very fruitful partnership, and coming back from Stanford, they've been able to show us, because of the kind of equipment and the experience that they have, been able to show us what's going on in the brain and in the body to a higher degree of resolution that's been able to help us improve further the treatment.
Building on what you've done with Stanford, I understand that you recently announced the launch of the world's first clinical Ibogaine program designed to accommodate patients with various neurodegenerative diseases: Parkinson's, multiple sclerosis, essential tremor, stroke, traumatic brain injury, and ALS, which I think is one of the most devastating and frightening of all diseases. Jose, can you sort of help us understand this?
Yes, so we are learning about this medicine and the effects, right? And everything, it came along by seeing people with this type of diagnosis come into what we call our foundational program and seeing really remarkable positive effects, in terms of multiple sclerosis. We have a case study that Jonathan wrote, and there was a co-author, and learning a lot about how these benefits was impacting these specific sicknesses, right? For example, with Parkinson, we just have a Brett Fard here with us in Ambio, and he was able to express how beneficial it was for him in terms of the tremors, not just on the physical level, but also the emotional level. So just giving you a more outline in terms of that, the program is way, way different to what we call it, to the detox program or the detoxification program and to the veteran program, right? And we're still learning what is happening with the persons, but we think that we have figured out a way and a specific protocol for them to reach certain specific therapeutic effects. And also, again, mitigating all the risks, because now talking about this population, we're addressing different risks, right? We're talking about more elder people with more cardiac issues, with other type of situations, physiological situations. And we have figured out a way how to mitigate those risks and create a benefit for them. So some of the benefits as being reducing the tremors and just in general benefit a lot the quality of life of these people. Also, what we have learned is that if we work at early stages of each of these pathologics, the benefits are better, right? So we're still learning from it. We're hoping to create more research, more data on these patients so we can start creating more case studies and publish about this. I'm going to let Jonathan to share a little bit about that too.
The program itself came out of this increase of interest in general in Ibogaine. And so we'd for years been working with sort of individual patients, but when this sort of influx of interest began to pour in, we were able to create these affinity groups of people with either Parkinson's or MS or different conditions who are able to go through the program together. So we're really rapidly scaling up the amount of data and clinical experience that we have about these kind of conditions. And we say that we're creating a program to accommodate these conditions rather than treat them, because the facility is designed to receive people who are in wheelchairs and have mobility issues, and we provide physiotherapy and other kinds of things, but we don't necessarily know exactly what to expect in terms of a treatment effect. So for years, what we've been telling people is, look, if you're at the end of the rope and you're wanting to try Ibogaine, we know enough now through the safety protocols that we've developed that we can screen and provide this safely for you. We don't know what the outcomes will be. But as Jose has been describing, it's been across the board positive. Some people respond much better than others. Some people are having really powerful transformative experiences very suddenly. Others, it's more gradual or more subtle, the changes. But in either case, these are changes that we're seeing in patients where nobody's necessarily expecting to see any benefits. So it is very promising.
I have to say, the more I've learned, the more intrigued I am. And Jonathan and Jose, I want to thank you for joining me and sharing with us what patients who receive Ibogaine treatments experience. And I want our listeners to know they can find out more about this extraordinary historic work that you are doing by visiting the Ambio Life Sciences website, which is ambio.life. That's AMBIO.life. And we'll certainly have that on our show page. But I appreciate the two of you taking time out of your extraordinary schedule to share with us, with our friends, the kind of exciting things you're now doing.
Thank you very much, Mr. Speaker. It's been an honor to be here and to share a little bit of our work. Thank you.
Yeah, thank you so much for your time and for the invitation.
Thank you to my guests, Jonathan Dickinson and José Inzunza. You can learn more about the Ambio Life Sciences on our show page at newtsworld.com. Newt's World is produced by Gingrich 360 and iHeartMedia. Our executive producer is Garnsey Sloan. Our researcher is Rachel Peterson. The artwork for the show was created by Steve Penley. Special thanks to the team at Gingrich 360. If you've been enjoying Newt's World, I hope you'll go to Apple Podcast and both rate us with 5 stars and give us a review so others can learn what it's all about. Right now, listeners of Newt's World can sign up for my 3 free weekly columns at gingrich360.com/newsletter. I'm Newt Gingrich. This is Newt's World.